Nee-Kofi, thank you so much for coming to talk to us. Joe and I are excited to learn from you about grant writing. I'm the expert, experienced mentor, and Joe is the novice researcher. So we both want to understand and learn from your experience.
Well, thanks for the opportunity to come share.
What we've been doing to start out is to ask people actual writing tips. So literally getting words on a page, mostly thinking about grants, not so much manuscripts. But do you do anything that really works for you to help you write words?
Yes. I cheat a little bit, and in that I actually don't write, I dictate.
Ooh, tell me more.
So before I actually even put pen or voice to the page, I actually first make sure that I understand what it is that I'm going to do, be saying I'm going to do in the grant. And once all of that is clear in my head, I actually find that typing or writing is a bit of a barrier to me just getting the first version down. So in our health system, we're blessed to have to use voice dictation software. And so recognizing that I do that clinically, I actually purchased a version of that for myself in my office. So what I do is I essentially dictate the whole grant, at least the first version of the whole grant, just using layperson terms, slang, anything I need to do just to be able to get it down onto a page. Then when that's done, and I have essentially a complete first version, then I go back and paragraph by paragraph I edit, so it sounds scientific and technical, but the first version does not.
That is so fascinating. I love that.
Yeah, we have not heard that so far. That's really cool.
It's interesting because you're getting experience doing that in the clinical setting. So somewhere at some time, you had to get comfortable like talking to yourself, talking out loud, right? Like that's a thing, right? Because I know I've seen, Google type or voice typing or dictation in Microsoft products. It's not as fancy as the clinical dictation software, but it's actually pretty shockingly good. And I've tried it, and sometimes I think this is so cool, but it does start out a little bit like I'm talking to myself. Can you talk about how you got to the point where it feels normal to do that?
Yeah, you're right. It's through practice. The first few times I did this in a clinical environment, it feels really weird and strange to be speaking to yourself and seeing the words just appear. And
oh, so are you watching the words?
Yeah.
Okay.
I just to make sure that
it's picking up.
Yeah, it's picking up the key bits, but I'm actually not scrutinizing all the details. I'm not reading it as I just speak, and I just kind of follow along just to make sure everything seems to be typed accurately.
Okay.
So it takes a while to get used to, but to be honest, in this day and age, we leave a lot of voice messages. A lot of international people use WhatsApp, and we leave voice memos for each other. I would encourage people to try it once, because I think it caters to a slightly different type of thinker, the way we process information. And perhaps for those of you who may be more, visual, auditory, this might work better. It will be at least one less barrier to getting the first version of your grant down.
It's brilliant. Actually, there's another researcher in our department who has a long commute, lives in the mountains, and he would say he would just record into his phone. So just have a voice recorder, and he would just talk his ideas while he was driving because he didn't want to lose that opportunity, and he would often leave his desk thinking about something, and he's quite well published. So, it must help.
Yes, it
That's
does.
Wonderful.
I've done that too. I leave myself voice messages, and I have an app on my phone that actually will send me the audio clip to my email inbox, so it's waiting there for me the next day.
You obviously have an outline. Now, let me just take you back. You said the very first thing is you got to know what you want to say, right? And that's a big challenge. That's not a little thing, right? I always find, I always think to myself, well, if I actually knew what I wanted to say, I would just write it. Like when you're struggling with writing, sometimes I actually don't know what I'm trying to say. And this is the problem. Like you have to stop and decide what you're going to say. So you decide what you're going to say, and then do you outline it, or do you give yourself some kind of notes to remind yourself of what you are trying to cover?
Sometimes, and don't get me wrong, I don't sit down at 7 in the morning and then at 5 p.m. I stop dictating. No, I do this in little chunks,
Okay.
15, 20-minute chunks based on the section I'm going to tackle. And before I dictate, I just spend a few minutes thinking about all the key things I want to say, sometimes jot something down, and then go ahead and say it and then dictate it.
Okay, you're actually giving me some more goodness. We've learned so much. Joe and I are already practicing some of the tips we learned. But one of the challenges is you don't always have a big block of time to write. And the busier you are, especially if you work clinically or you are having phone calls at odd hours because you have international collaborators, you might just have a short chunk. And so it sounds to me like this could help you not need so much time to get into a writing zone. You can talk it out while you're thinking about it, and you don't have to see the imperfections of the words on a page, and you just get your thoughts down.
Yeah. So you work in the clinic. Can you tell us a little bit about what you do?
Sure, I'm an emergency physician. I work in a very busy level 1 trauma center in Aurora in Colorado. And it's the University of Colorado Hospital, and I primarily see patients when I'm working, and I teach residents and medical students. That's what I do.
Okay, so question, your research is global health type, international research, and you work as an emergency physician domestically. Can you talk about how you came up with your research interests, and how does it sync with your training, or does it?
Yeah, it absolutely does. So actually, after completing my residency in emergency medicine, I went on to complete 2 fellowships, one in global health and one in pre-hospital care, so EMS. And that was deliberate because I wanted to converge my expertise in these areas, and fellowship training provides you a really unique opportunity and protected time and resources to really delve into this content area. And so the rest of my career essentially evolved from my fellowships. But I had a plan in mind. I knew what the end goal was, sort of the areas I wanted to have expertise in and the areas I wanted to devote my career to. And then, decided that I would invest my time early on in my career as a fellow to really gain the expertise I needed that would help launch me on the rest of my career.
We have talked to people. This program is really for people who are contemplating their first major grant, whether often for an early career researcher, a novice researcher, you're trying to get to that mentored career development grant, your K, in US NIH terms. And I remember, Nee-Kofi, when you were writing your K, even though now you're a big deal professor, can you talk about what you tried to line up to make you ready to write a career development award?
Yeah, good question. So, there are multiple key ingredients one needs for a career development award, and the research project is just one of those, as we all know, having a team of mentors, having a well-formulated career development plan, because the career development award really exists to help give you the training and experience you need to set you up for expertise, in your chosen field.
Except, wait a minute, you just told me you're an emergency physician and you did 2 fellowships. I mean, how much more training do you need? Come on, right? This is the game, right?
That is exactly the game.
Okay,
And so
let's talk. What did you say you needed to learn?
Yeah.
More. There's more. Oh my
Yeah,
gosh.
so I did not, for example, have a master's degree or a PhD. I did not have training in some areas that I really wanted to gain more expertise in, and those were implementation science. I wanted to do some studies that were more epidemiologically focused. I also had aspirations about doing interventional studies like clinical trials that were pragmatic. And so realizing that these were necessary parts of my career and of my research project and my career development plan, I proposed training activities around all those areas, and I was able to demonstrate that actually had never acquired those skills and needed a time and mentorship to develop those skills for my future.
Right. So for a successful grant that way, it's this fine dance of saying you're highly trained, you're prepared, except for this one or two or three other things, very specific things, that if you could just prepare yourself to get this thing, then the world is your oyster. You're going to be able to be an independent researcher.
Exactly, yeah. So it's a fine line. You can't be over or under trained. You have to be in this sweet spot. Right. And additionally, the area of training you're asking to undertake during your career development plan has to be intimately linked and connected to your research project.
This is the big, sometimes I think of it as a Rubik's Cube, because you change one thing and then it changes something else, and you need your training aims to line up with your research aims, and then the third dimension is the mentorship team. Could you talk about finding mentors who would line up? It sounds like this is a very specific ask.
Absolutely. And it's funny you say you think of it as a Rubik's Cube. I think of it as a 1,000-piece jigsaw puzzle. Every piece has to fit perfectly to see the thing that you're proposing. 1,000 pieces. Nope, 1,000 pieces, yeah. Okay. And so the mentorship or the mentors are multiple key pieces of the puzzle. And so in this day and age where we're heavily in multidisciplinary team science, most projects require multiple levels of expertise to be involved as collaborators in the research project. It's rare that you will need a mentor, and increasingly it's a mentor team that's required in most projects. And so I typically think of a content mentor, a methodologic mentor, and a global health mentor. And those can all be in the same person, but usually in this day and age, they exist in different people. And so for me, for example, in my career development applications, I had two co-primary mentors, one in global health and one in emergency medicine. And then I had three content mentors in areas of my proposed research, which were around hemorrhage and shock for trauma, epidemiology, and also implementation science. And so I cobbled together a team of 5 mentors because no one person had everything I needed, and I realized I needed to lean on a large team of experts to help with my training and development.
Where do you find these people?
Well, lucky for me, I was fortunate to be on a campus that had the expertise I needed, and except for one person who was on a different health campus, and I was able to invite that individual to join as part of my mentorship team. But it's a great question, and it's increasingly normal to actually have mentors who don't exist in your university or your institution, and they're somewhere else. And insofar as you can demonstrate a cogent plan for having time with them and being able to complete the activities you need, I think it's very feasible, and a lot of people do include mentors at a distance. The one caution is ideally one of your primary mentors should be local. That's preferred, and then you can have a mixture of where these experts are. Especially in global health, they may not be. You may actually need one of your mentors to be in the host country internationally. It's perfectly fine and actually important.
You keep mentioning a plan, like a career plan or a path. Mm-hmm. When you were younger, did you always know this is where you wanted to go, or did you kind of decide along the way, or how did you make a plan?
Yeah, great question. I think I always had a big picture plan. So I was born overseas, and I always wanted to do health development in sub-Saharan Africa. And specifically, I wanted to do emergency medicine because I knew that there was a shortage of emergency physicians, and emergency medicine as a specialty was underdeveloped across Africa. And so that was my big picture career plan. I was like, I want to do emergency medicine. I want to do work in Africa somehow, in terms of development. But I actually didn't know I wanted to be a researcher. And I didn't know I wanted to do pre-hospital care or trauma care. And those were things that sort of clicked into place, in part because of the mentors I had when I was a fellow and interests and opportunities that came up early on. So I would say the answer to your question is it's half and half. Mm-hmm. You have to have some focus in terms of your career based around your passions, ideally. And then second, some of the specific areas you wind up researching in or devoting your career to are partly opportunistic based on the people you have around you, the opportunities that come up in terms of grants and funding and projects and needs and so forth. Yeah, so I'd love to say that I had this perfect plan in mind and everything was to get, but the truth is that some of it was circumstantial. And I'm pleased, by how by those opportunities as they came up. Yeah.
Right. I will add, sometimes to be opportunistic, there's a particular mentor, or there's somebody with a project, or there's something you can try, and sometimes it works out great, right? And you end up really liking the mentor, or you really like the project, and you say, okay, I wasn't aware of this, now I'm going to do more. Sometimes, unfortunately, or fortunately, you say, not for me. And that's part of the thing. Like, it is real, and everything, you just want to learn from it. Because in any project, hopefully you get more than a lesson of what not to do, right? But there's some things like, this part of it was really amazing, I want more like that, but then these other parts are less than amazing. Let's wrap it up and move on. So, it does, I think, in hindsight, look like you always had this perfect path. But no, if you really got into the weeds, you would see, I started here and then I back up, go here, back up, and you sort of swing your way forward.
Exactly.
Good. Let me ask you another piece of being ready to write a career development award, even though officially you don't need this. It's called pilot data. So some evidence of the phenomenon you're studying, or some evidence that you could measure it should you choose to study it. How important do you think pilot data is to a winning grant, whether early or mid-career?
Yeah, and I'll preface this by saying that I'll give my answer in the context of doing global health projects. Okay. It is critical. No matter what anybody tells you, it is critical, because at the end of the day, in any international grant, the reviewers are wondering, can this person really pull this off? Can they really access the patients they need and collect the data in the context that they're proposing? And there is nothing more convincing than showing some of the data to say, yes, we can. Yeah. And so I think of this in two levels. One is, you don't really have much data specific to the disease or the process that you're studying, but maybe you have some data around that. So for example, if you are interested in, let's say, studying trauma care or stroke care, but for some reason you have a data set of all the folks who visited an emergency department or a hospital, and within that are buried some of these patients you're interested in. Great, you can show those data to say, yeah, I have access to the facility. And within the facility lie all these patients that we will study in the future. That's better than nothing. And I've done that before. The other more fortunate circumstance is, should you be so lucky to have preliminary data focused on the disease and the condition you're actually studying, that puts you in, of course, a much better spot. However, the trick there is not revealing too much data, because then the expert's like, well, you have everything you need already, so why do you need this? What do you need this grant for? Yeah, so I would say in general, some preliminary data are better than no preliminary data. The worst circumstance, well,
how bad it could it get?
well, let me see a different way of framing that. Should you have no data at all, one recommendation would be to try and pull papers, or look at others who've studied the similar disease in that similar environment to say that, yeah, we don't have these data yet, but others were able to get these data, hence the population exists, the disease exists, the needs exist.
So not just measures of the concept, like prevalence of stroke in an area, but somebody managed to get data from the region you're interested in studying, and so you could say, well, it has been done, it could be done, it hasn't been done by us yet.
Yes.
Okay.
And ideally you pull that person on your grant as a consultant, and then you can say, we have previously accessed this data.
Yeah. Well, that's what I was thinking. Sometimes that's the real value of a key mentor, is they've had access to that data, even if it's really a different population. But if they've done the process of joining with a partner hospital in the country of interest, they've been able to recruit patients or pull data from an electronic health record. That is the next best thing.
Exactly.
And so that, just that alone is good enough to potentially ask somebody to join the mentorship team.
Exactly. And I would add that if you are particularly light on preliminary data, this is where I think asking your referees, those who provide letters of support or recommendations for you, to somehow layer in some of that to say, yes, we have access to the data. We will ensure that the applicant will also have access to the data, I think helps overcome that potential limitation if you shouldn't have enough preliminary data in your application.
Do you ever have to adjust your primary question or hypothesis for like the data that you have access to?
Yes, that's called real world. Yeah, unfortunately, it's not, especially in global health, you never know what's going to happen, in terms of access. I remember one of our grants, which started during COVID, the epidemiology changed, and impacted the sort of interventions that were being performed during COVID on trauma patients. And as a consequence, some of the outcomes we were looking for and the interventions we were looking for didn't quite exist. So we wrote to the funders and pivoted, in our research question and said, listen, when we'll need an extra year likely in the tail end of COVID to help answer that question. In the interim, we'll be able to answer these additional questions that are intimately related to the grant. And that was well received. Mm-hmm. So yes, changes happen. Yeah.
That's a really good question. It's real. Yeah. There's always changes. Could we talk about writing grant proposals to various types of funders? So as we discussed, we're at the University of Colorado. We're in the Mountain West of the United States. We write generally to our major federal health funder, the National Institutes of Health, or NIH. And there are private foundations, philanthropic foundations who exist to support certain kinds of things like the American Heart Association or the American Diabetes Association. And then we have a federal funder of our military, the Department of Defense, that also funds some health research generally related to active duty military personnel or their families. Can you talk about, if you were going to write, I think there's quite a lot of tailoring to the funder. Can you talk about your experience sort of targeting different funders?
Absolutely, wonderful question. I've been fortunate enough to have applied to all three and received grants from all three categories.
Perfect.
Yeah, in the area of global health. So let's start with the National Institute of Health. To me, there are two scenarios when one applies for an international focus grant at the NIH. And one scenario is the grant is co-sponsored by the Fogarty International Center, which is a branch within the NIH. And so typically Fogarty International Center either offers its own grants or partners with other NIH institutes to co-sponsor a grant. The second scenario is when Fogarty International Center is not involved. And there's a reason why it's important to know whether or not Fogarty is involved. So in scenario one, if Fogarty is involved in a co-sharing or cost-sharing, co-sponsoring the grant, typically Fogarty International Center reviewers will be part of the review board. And that's really important because they are very well sensitized and acclimatized to reviewing international grants without having to answer the question, how does it benefit the U.S. taxpayer? And so you can write a more, let's call it a more traditional style global health grant. You can speak about the international needs and the global impact and benefit of doing the work. However, if you are applying for a grant at a typical NIH institute that does not involve Fogarty and does not specifically have an international focus, then you actually have to go through the business of strongly justifying why it is that your grant needs to be done somewhere else in the world outside the U.S., and specifically how that benefits the U.S. taxpayer.
Because the money for the NIH comes from all of our taxes.
Exactly.
Right? And that's ultimately their accountability.
Exactly.
Okay, so let me just make sure I understand this. there's some grants that are officially global health, and that's the Fogarty focus, and therefore you have expert reviewers who are already educated about the why, versus no formal involvement of global health researchers or a cause or a priority area. And therefore you have to do a little more educating, a little more justifying the rationale of your study. Is that right?
Exactly. And some reasons you might need to do a project overseas that benefits the American taxpayer, for example, is either because the disease is not does not exist in the US with high enough incidence or prevalence, hence it'll be completely cost ineffective or inefficient to try and do the project stateside, so you can justify doing it overseas, which has mutual benefits. It benefits the international population and it benefits the American taxpayer. Another angle is studying the disease overseas helps in a selfish way with US strategy, national security, pandemic and disease surveillance, and so forth. And so you can say, this disease is not in the US, for example, Ebola or Marburg. However, if we study it overseas, we'll have a better handle on the disease.
We ever face it.
If there's ever a global pandemic, so we can survey or detect it internationally before it comes to the US, and should it come over here, we're already prepared because we understand more about the disease. So these are just some strategies to help show or demonstrate the value of studying something internationally that otherwise would be difficult to study in the US.
Would you say it's harder to get funded for something like that that's not in the US yet? Or do you think it's like for some of these new diseases that we haven't seen yet, do you really have to justify yourself? Like, this that could come here, this is very contagious.
I think COVID taught us well.
Yeah.
There are some benefits to COVID.
You think that's going to make it easier for like moving forward?
I think in terms of infectious diseases, and I think everyone is more sensitized to the fact that this truly is a global community, and a small problem in an obscure corner of the world could become a big problem in our backyard very quickly. And hence it behooves us all to be globally focused and sensitized. At least that's my bias.
I agree. I mean, now it's not like it could happen. We have an example. Yeah. And I think the other silver lining to COVID was, as you were talking earlier, you might need mentors all over. And I think COVID showed us that people can really do projects and have relationships via Zoom or via face chat, WhatsApp,
Exactly.
Technology can help us continue in our work and expand our reach. So suddenly having 4 of your 5 mentors away from your institution feels probably acceptable,
yes.
Whereas back pre-COVID, we would say you can have 1. Nobody will believe you. There's always a little bit of like, could this work? Anyway, I want to come back to what you're talking about, but I wanted to reflect that there are multiple ways that experience actually advanced the way we can do research.
Correct.
Yeah. Okay, now let's turn to foundations. How do you think about that?
Yeah, so foundations, I think one has to really study and understand the mission and the priorities and the strategic sort of goals of the foundation. Yeah, and you have to just speak directly to those, and then everything else I said applies. If it's a US-based foundation, you have to justify why it is that doing it internationally is beneficial. But I think most foundations don't have the same hurdle the NIH has to overcome, which is you don't have to justify the what's in it for the US taxpayer. You just have to speak to the foundation's priorities.
Right.
Yeah, I found foundation grants to be somewhat easier to write, to be honest, because you just speak to the thing they feel passionate about and you share your passions, and so I feel like the why is usually not as big of a deal or a challenge.
If it's aligned.
Yeah.
If that's the big if, right? You need to find one.
Exactly. That's
the tricky thing. Sometimes there's a mission statement for a foundation and you're like, it's kind of related, sort of, if you squint and hold it back like this.
Yeah, then you have your work cut out
right,
for you.
Then it's a little bit of a stretch.
Yeah.
But if you can find a foundation that says, we care about global health and and you say, me too, let's go.
Yeah, and at least from the foundations I've written to, I would say their applications are fairly lean.
Yes.
Per grant dollar awarded, the amount of the application burden is fairly light, at least in my experience. Compared to the NIH.
Agreed.
Yeah.
Where do you find these foundations to write?
Yeah, great question. I think part of it is you have to know your community, and you have to do your research. You have to Google, ask around. We have in our university, we're fortunate. We have an office that is dedicated to helping us find various traditional and non-traditional sources of funding. So I leverage those. I went on Google like everybody else, and when you go to conferences and meetings, just sort of keep your ears up and your eyes peeled, and to spot folks who are aligned with you and who have funding streams.
Yes, and I think it does change over time. Sometimes there's special calls, so you do always have to keep your eyes out, or your ears open, and let people know. That's the other thing. Let people know you're looking for a source to fund this, and hopefully your friends will think of you. So, yeah, okay, now let's turn back to federal funding for active duty military. We have the Department of Defense, we call it DoD, which does fund health research. Could you talk about how you have to further tailor to that kind of a funder?
Yeah, absolutely. I think a lot of folks don't understand that the DoD has an explicit dual mission to improve the lives of both service members and their families, and also civilians across the world. So in trauma, for example, the US DoD has funded some of the largest innovations in trauma care across the world, over the last few decades. And so a lot of researchers, community members, academics, non-academics don't realize this about the US Department of Defense. However, there are several caveats and tricks to applying for DoD grants. And I would say one of the most important lessons I've learned is the importance of collaborating with internal DoD intramural investigators, because they can really speak to the DoD's needs and mission in a way that is difficult for non-military personnel, to be honest. They write the significance of the work with such ease, compared to non-civilians. And I think it makes the work just feel like a much better fit for the military's needs. So I would highly recommend having an insider, a DoD person, as a co-investigator or a collaborator of some sort on a DoD grant. But so in all DoD grants, you have to, in the significance section, write to why is this significant, why is it important for the military population, and how is this work also going to benefit non-civilians. This is at least from all the trauma grants I've run to the DoD, these are very specific sections in the grants you have to speak to. And so you have to find that disease process that is relevant to both populations to have maximal impact, to get the highest impact score in your grant. Yeah.
We can't let you go without, you said you need an insider, you need a DoD insider because they can write this section. How the heck do you find one of those?
Yeah, great question. I think one way is just to look at military publications and find military authors and investigators who've been prolific in publishing in your area.
And reach out to
them. Yeah, reach out to them. Again, having been funded by the DoD for a few years now, I would say this is a really sort of affable and a very easy to communicate with group of folks, and who enjoy collaborations across sectors. And so I've been very, very pleased and by the sorts of DoD collaborations I've had over the years. Yeah, so I would say reach out to them. We're fortunate at our university because we actually have a center that's focused on military care and research.
Yeah, that's a great place to start. And it sounds like that's actually good advice, whatever you're doing, yes. Right? Look at the literature. If you find a paper you love, you're like, that guy or that gal, I want to know them. Reach out to them or go to the conferences on the topics you're interested in. Try to meet people that way. That's great. This is very helpful, Nee-Kofi. We really appreciate you.
My pleasure. Thank you so much for having me. Yeah.